Warning signs of pregnancy. Warning means alarming. You can call as a danger signs too, which needs an immediate attention of the doctor to handle it. Loss of consciousness. Dizziness and the fainting are often caused by a drop in the blood pressure. The hormones released during the pregnancy allows to relax the body's blood vessels. Too little blood is then pumped to the brain. When this happens, you lose consciousness or you faint. The next sign is fever for more than 24 hours. The temperature may rise to 101 degree Fahrenheit. It may be caused by the urinary tract infections or the respiratory viruses. But other infections could also be the reason. Common causes of the fever during the pregnancy include influenza and pneumonia. The next danger sign is yellow discoloration. Yellow discoloration indicates jaundice. A medical term for the yellow discoloration is icteric. Yellow discoloration can be seen on the skin, nail, or sclera under the bright light. That is an important symptom of elevated serum bilirubin. Severe headache. Severe headache indicates increased blood pressure. Normal blood pressure is 120 by 80 mmHg, where 120 is a systolic pressure when the heart contracts to pump blood out, and 80 mmHg is a diastolic pressure when the heart relaxes after the contraction. If diastolic pressure increases above 100 mmHg, you can expect the fits or so-called seizures or convulsions. Blurred or double vision. Fluctuating hormones are even responsible for swelling during the pregnancy. Fluid can accumulate in your eyes. Water retention can increase the pressure in your eyeball and make your cornea thicker, resulting in the blurry vision. Fits or the convulsions. High blood pressure results in seizures during the pregnancy. Seizures are the periods of disturbed brain activity that can cause episodes of staring, decreased alertness, and convulsions, or you call it as a violent shaking. Dizziness or increased blood pressure. Spots before the eyes. Consistently seeing spots or flashing lights in the front of the eyes or blurred vision or being oversensitive to the light are the signs of the medical condition called as a pre-eclampsia. Swelling or the edema. Fluctuating hormones are even responsible for swelling during the pregnancy. Unfortunately, fluid retains in the feet or on the lower part of the body. If the fluid retains in the face, it is called as a facial edema. Can you see the difference between the normal hand on the right and the edematous on the left? The normal foot is on the left and the edematous foot is on the right. Pre-eclampsia, and these signs and symptoms include pre-eclampsia as well as eclampsia. What is the highlighted word P.R.E. means? Remember, these are the three cardinal or important signs of eclampsia. The capital P stands for proteinuria. Proteinuria means it is a protein lost in the urine. This may be from 0.3 grams to 10 grams. More the protein lost in the urine, more the swelling. Protein which is lost in the urine is albumin, which maintains the fluid pressure in our body. That is called as osmotic pressure. And the second letter is R. R stands for the raised blood pressure. Normal blood pressure is 120 by 80 mmHg. As I told you, if the diastolic pressure exceeds more than 100 mmHg, it leads to the convulsions or the fits. E stands for the edema. Edema is due to the proteinuria. Edema is accumulation of the fluid in the cells. It may involve face, so that is called as a facial edema, and if it involves the foot, it is called as a pedal edema, and if it involves the whole body, it is called as anasarca. How can you identify anemia in the pregnancy? Remember, anemia is the main reason for bleeding after the labor, which may result in death too. Breathing difficulty at rest. When you are healthy, more oxygen is taken to the heart, muscles, and organs. With anemia, the lungs overcompensate in order to bring in more oxygen, causing breathing difficulty. Low levels of hemoglobin prevent adequate oxygen from reaching the brain. Palpitations. In cases of severe anemia, the heart tends to compensate for the lack of red blood cells reaching the body tissues by pumping faster. A condition is called as tachycardia. You can feel this tachycardia as a strong as well as a rapid heartbeat when you place your palms on your chest. Easy fatigability. This fatigue happens because your body lacks the iron. It needs to make a protein called hemoglobin, which helps to carry the oxygen around the body. Without enough hemoglobin, less oxygen reaches your tissues and muscles, depriving them of energy. Pale eyes. The hemoglobin in the red blood cells gives the blood its red color. If hemoglobin is less than the normal, it looks pale. This is the normal red color seen in the lower conjunctiva. And this is the pale eyes indicates anemia. Pale tongue or nails. This is the normal pink color indicates good blood supply. This is the pale tongue showing anemia. This is the pale nails. You can assess this through the capillary refill time. Capillary refill time is defined as the time taken for the color to return an external capillary bed after the pressure is applied to cause blanching. Wait till it blanches. Look at the color. Normal capillary refill time is usually 2 seconds or less. Prolonged capillary refill time indicates shock. Excessive or persistent vomiting. Persistence means continuous. Vomiting in pregnancy is normal due to the hormone human chorionic gonadotropin. This occurs up to first 3 months of the pregnancy. If it extends beyond that or leads to fainting or decreases BP, it requires hospital admission, and this condition is called as hyperemesis gravidarium. Severe epigastric pain. It leads to the HELLP syndrome. HELLP syndrome is a disorder of the liver and the blood that can be fatal if left untreated. HELLP, H-E-L-L-P, is an acronym. H stands for hemolysis, which means breakdown of the red blood cells, which results in increased bilirubin. EL stands for the elevated liver enzymes, particularly SGPT or SGOT. And LP stands for the low platelets. The normal platelets are from 1.5 to 4 lakhs counts. Platelets are the one important for arresting the bleeding. And if it is going to be less than 1 lakh, it is called as low platelets. So this occurs in the HELLP syndrome. So severe epigastric pain is a danger sign. Along with the epigastric pain, they may have nausea, vomiting, and tiredness. Normal fetal movement should be approximately 10 movements per 12 hours. In a pregnancy, a pregnant woman can feel the fetal movement by 18th or 20th weeks of pregnancy. First movement felt by the mother is called as quickening. Decreased fetal movements, that is less than 10 movements per 12 hours, or no fetal movements, that is 0 per 12 hours, or increased fetal movements, which is more than the normal is, will lead to the intrauterine death. The next danger sign is severe pain, that is in the lower abdomen. It may be due to labor pain. The signs of the labor pain include contractions or tightenings of the abdomen with a shows nothing but a plug of mucus from the cervix, or with a back pain or an urge to go to the toilet, which is caused by the baby's head pressing on the bowl. Water breaking all includes labor pain. The next one is rupture of uterus. There's a big difference between the pains that occurs normal in labor pain and the rupture of uterus. The main difference is the pains will be between the abdominal tightening. That indicates rupture of uterus. How can you feel the abdominal tightening? Just place your palms on your abdomen. You can feel the tightening of the abdomen. That is called as contractions. One more reason could be ectopic pregnancy. Ectopic pregnancy means when a fertilized egg attaches and grows other than the upper part of the uterus is called as ectopic pregnancy, and when it ruptures, they may have a severe pain. Premature labor pain is another danger sign. Preterm labor can result in the premature birth. Smoking or being over or underweight before the pregnancy, or being in your teens or age above 40 or older, or not getting a good prenatal care, or drinking alcohol, or using street drugs during the pregnancy, or having a health condition such as high BP, pre-eclampsia, diabetes, blood clotting disorders or infections, or being pregnant with a baby that has a certain birth defects, or being pregnant with a baby from in vitro fertilization, or being pregnancy with twins or other multiples, a family or a personal history of a premature labor, or getting pregnant too soon or after having a baby are the reasons for the premature labor. Normally, labor pain starts and should start after 37 weeks of pregnancy. In layman terms, it is after the first week of the 9th month pregnancy. The lung of the baby completely matures only after 37 weeks. In case the baby is born before that, the baby may face some respiratory distress problems, particularly the babies who are born before 34 weeks. The next danger sign is vaginal bleeding during the pregnancy. There could be 4 reasons for severe vaginal bleeding during the pregnancy. The number 1 is abortion. Abortion is the expulsion of the pregnancy products or the products of conceptions before 28 weeks of pregnancy. It is accompanied by the bleeding. The second reason could be the ectopic pregnancy. Ectopic means not in a normal place. Pregnancy normally occurs inside the upper part of the uterus. Pregnancy occurring anywhere other than the upper part of the uterus is called as ectopic pregnancy. So when it gets ruptures, they have bleeding. This is where the normal placenta is attached and grows. And when the placenta is implanted at the lower segment is called as a placenta previa. Painless and the severe bleeding is the major sign of the placenta previa. Normally, placenta separates from the uterus after the delivery of the baby. When the placenta separates before the delivery of the baby is called abruptio placenta. The bleeding may be seen, that is revealed, or not seen, and that is concealed. The next warning sign is sudden gush of fluid from the vagina, You call it as leaking per vagina too. It's due to the rupture of membranes. Normally, leaking of fluid from the vagina occurs during labor when the rupture of membrane takes place, hence called as premature rupture of membrane. Premature rupture of membrane refers to the patient who is beyond 37 weeks of gestation and has presented with a rupture of membrane prior to the onset of labor. Something called as preterm premature rupture of membrane before 37 weeks. Rupture of membrane takes place. Foul smelling vaginal discharge is bad smell, or you can call this as a bad odor. Medically, you can call as an offensive discharge. If the odor is accompanied by redness or itching or burning or unusual discharge, you might have a yeast infection, a fishy ammonia, a type smell such as bacterial vaginosis, which can trigger preterm labor. Hence, foul smelling discharge needs attention. Decreased urination. The inability to urinate, retention, may be caused by the infection, particularly the urinary tract infection. Frequency of urination, that is, a number of times to urinate, normally increases in the first and the last trimester due to the uterus enlargement, is normal. Calf muscle pain is considered as a deep vein thrombosis by some physicians. It was defined by the John Homans in 1941 as a discomfort behind the knee upon the forced dorsiflexion of the foot, and this is called as the Homan sign or dorsiflexion sign. If the sign is positive, it indicates deep vein thrombosis. Know better, care better, and these are the danger signs of pregnancy. Do subscribe. Thank you.